I'm Joseph Valdez, and I'm the Program Director for Geisinger's Addiction Medicine Fellowship Program. One of the good things about our program, I think one of our strengths of our fellowship program is just so diverse. It gives a very comprehensive education in all the areas of addiction medicine that a new physician in training would want to gain experience. So our curriculum reflects that. One of the strengths of our curriculum and of our program in general is Geisinger Marworth. Marworth is a residential treatment facility for patients with substance use disorders, been around for over 40 years. It's been ranked number 1 in Pennsylvania for the last 2 years and top 5 in the country. So it's a wonderful environment. That is sort of the home base, historical home base for our fellowship. It's a wonderful environment to interact with very passionate, committed individuals treating patients with substance use disorders. It's a great environment to learn how to manage inpatient withdrawal and medication treatment, as well as gain experience with some of the counseling modalities that are important in our field. And it's a really multidisciplinary staff. So all of our fellows will work at Marworth, have opportunities to participate there. As well, we have a number of outpatient addiction clinics, 4 outpatient addiction clinics across northeastern and central Pennsylvania. And so you really get experience there, medication treatment, ambulatory withdrawal management, for a variety of patients with substance use disorders. We also have collaborations with different specialties within Geisinger, which is one of our strengths as well, just that academic environment that we have at Geisinger. Our fellows will interact with OBGYN and care for pregnant and parenting women. They'll gain a lot of experience with psychiatry, both consult psychiatry and adolescent psychiatry, because there's such a co-occurrence of mental illness and addiction. We have a great faculty. We have a number of board-certified addiction medicine specialists. There's a lot of direct sort of one-to-one feedback to our learners who interact very directly with myself and other members of our faculty. And I think it's a strength. There's a lot of collaboration, a lot of department meetings, a lot of opportunities for presentations, either listening to or even providing during the course of the fellow year. I think one of the real strengths of our program, one of the most unique things, we're one of the oldest programs in the nation. We were one of the first 10 programs across the nation accredited to provide addiction medicine education. Our program started in 2008. So Geisinger has demonstrated a long commitment to addiction medicine education over the years. It's always been a value of this organization. And over that time, we've really learned, how best to provide the most comprehensive addiction medicine education as we can. The program has grown and evolved as our field has grown and evolved in very recent years, but we've been doing it for a very long time, and I think we do a very good job of it. So, in addition to the many different clinical experiences you get the benefit of a program that has long experience.